All right, let's talk about something that can sound pretty scary. Brain tumors. When we hear those two words, our minds often jump to the worst-case scenario. But that's not the whole story, not by a long shot. Today, we're going to pull back the curtain on one specific type of tumor, and what we're going to find isn't a story about fear, but one about incredible medical precision and ultimately, a whole lot of hope.
Okay, so first things first, you have to understand that not all tumors are the same, not even close. The biggest difference really comes down to how they grow. On one side, you've got a diffuse glioma. The best way to think about this is like invasive grass in your lawn. It sends roots out everywhere, and it's almost impossible to tell where the bad stuff ends and the healthy brain begins. But then on the other side, you have a circumscribed glioma. This is totally different. It's more like a single weed in a garden. It's contained, it has clear borders, and you can usually just pull the whole thing out. And that one single difference, it changes everything.
So today, we're zeroing in on one of those single weeds. The star of our show, if you will, is a circumscribed glioma called a pilocytic astrocytoma. We'll just call it a PCA for short. And as you're about to see, this is a story with a very, very positive outcome.
Now, this is the most common type of astrocytic tumor found in kids, which, is always a serious subject. But here's the thing. There's immediate good news. Because it's one of those contained, circumscribed tumors, the prognosis is just so much better than the diffuse types.
And this number right here, it's incredibly telling. A full 75%, 3/4 of everyone diagnosed with the PCA is under 20 years old. And because the patient profile is so specific, it's allowed doctors to get really good at spotting the patterns and knowing exactly how to approach it.
So, where do these things actually show up? Well, this chart gives us a fantastic breakdown. They can pop up in a few different places, but look at that big slice of the pie, 42% in the cerebellum. That's the part of the brain at the back of your head that handles balance and coordination. Knowing where to look is always the first piece of the diagnostic puzzle. So, how does a doctor go from a patient's symptoms to an exact diagnosis? Well, this is where the real medical detective work begins. It's a combination of super advanced imaging and then getting down to the microscopic level. The first and most powerful tool in the toolbox is the MRI. And for these PCAs, especially the ones in the cerebellum, doctors are on the lookout for a very specific, almost textbook visual signature. And here it is. This is the classic sign. It's a cyst, which is really just a fluid-filled bubble, and attached to the wall of that bubble is a solid little lump called a mural nodule. Now, when they use a special contrast dye during the MRI, that little nodule lights up like a beacon, while the cyst wall around it usually doesn't. Seeing this cyst with mural nodule, well, that's a massive clue for the radiologist. It practically screams pilocytic astrocytoma.
Okay, so the MRI gives them a huge lead, but to be 100% certain, they need to confirm it by looking at the tissue itself under a microscope. This is called histology, and PCAs have a totally unique fingerprint here too. Pathologists see two different patterns right next to each other. One area has these dense, tightly packed cells that look kind of like tiny hairs. That's actually where the name pilocytic comes from. And the other area is all loose and spongy. Seeing that unique mix of dense and loose, that's what clinches the diagnosis.
So, they have an exact diagnosis. What's next? Well, for this particular tumor, we get to the best part of the whole story, the surgical solution. And we're not just talking about managing the problem, we're talking about a cure.
I mean, this quote from the source material really says it all. Just let this sink in for a second. Complete surgical resection is usually curative. Because the tumor is contained, because it's that single weed with clear borders, surgeons have a fantastic chance of getting every last bit of it.
And what's so amazing is just how elegant the surgery can be. The target isn't the whole big thing you see on the scan. No, the focus is specifically on that little nodule that's the active part of the tumor. The main goal is just to remove that little lump. And here's the really fascinating part. Surgeons can often leave the wall of the cyst behind. It's typically not part of the tumor, so taking it out is completely unnecessary. It's just this beautifully precise approach. And this all brings us to the real takeaway of this whole story. By understanding exactly what kind of tumor this is, that it's contained, that it has a classic look, a specific structure, the entire outlook for the patient is completely transformed. And the results? Well, they speak for themselves. The 10-year survival rate after a successful surgery is over 95%. I mean, think about that. For more than 19 out of every 20 patients, surgery alone means they can go on to live a long, healthy life, totally free from the tumor. It's just a powerful testament to getting that diagnosis exactly right. All right, so let's just do a super quick recap. Remember, the word circumscribed is your first piece of good news. It means it's contained. The pilocytic astrocytoma, while common in kids, has a fantastic prognosis for that exact reason. Doctors spot it with that classic cyst with mural nodule on an MRI. And for so many patients, a focused surgery to remove just that nodule is a complete cure.
And that leaves us with this one last thought. What we've seen today is that not all brain tumors are created equal. They have different personalities, right? Different ways of growing, different places they like to be. And by figuring out a tumor's exact personality, we can transform a diagnosis from something filled with fear into a clear roadmap toward a very hopeful and healthy future.